Hi, my name is Devin, and today I'm going to discuss the demographic indicators of Switzerland and also provide a brief summary. Switzerland is located in Central Europe and borders five countries: France, Italy, Germany, Austria, and Liechtenstein. Switzerland has a population of almost 9 million people. This country is also known for its mountainous terrain, with many people living in rural areas. This can make access to healthcare more challenging, especially for those living in remote regions. Switzerland has addressed this by maintaining a strong healthcare infrastructure, which includes having a high number of providers. For every 1,000 people, there are about 4.5 physicians, which can help ensure that the populations that are living in rural areas can still have access to care. Considering the economy, Switzerland is one of the wealthiest countries in the world with a strong and stable economy. This allows for higher levels of healthcare spending and investment for medical services. This economy can also help residents afford health insurance with additional support systems that are there to ensure coverage is accessible. These factors can contribute to Switzerland's high life expectancy, which is about 83.3 years, which is one of the highest life expectancies globally. Historically, Switzerland's healthcare system plays a major role for its success. This country has had a system of mandatory health insurance, which was introduced in 1991 and requires all residents to have coverage. Switzerland has developed a balance between private health insurance providers and government regulation. The government sets standards for benefits and pricing, but also ensures the safety and quality of pharmaceuticals and medical devices. This approach has allowed Switzerland to achieve universal coverage while still maintaining efficiency and allowing choice within the system. Switzerland's healthcare system is shaped by its geography, economy, and the mandatory health insurance has played a big role. These factors can help explain the country's high quality healthcare system and its excellent healthcare outcomes. Next, Sydney will discuss Switzerland's health system structure.
Next is the health system structure. It consists of a mixed public-private system, which combines public funding, subsidized private insurance, and out-of-pocket payments. It has one of the lowest shares of public funding in Europe. They require a mandatory health insurance model. All residents must purchase compulsory basic health insurance, provided by private, non-private insurers under federal regulation. Health system structure continued. Decentralized organization. Healthcare is organized at three levels: federal, cantonal, and local. Cantons are regions, and they regulate and plan services, fund and oversee hospitals, and manage public health programs. Healthcare provision. Services delivered by a mix of public and private provide. Hospitals may be public or private, and strong competition between providers and insurers.
Hey guys, I'm Austin. I will be covering our financing. So financing overview first. I'll give a quick overview of how healthcare financing works in Switzerland. So Switzerland has a pretty unique system where everyone is required to have health insurance, but instead of the government running it, it's actually handled by private insurance companies. Healthcare is mainly paid for in three ways: monthly insurance premiums, out-of-pocket costs like deductibles and copays, and then government funding through taxes. Because of how the system is set up, Switzerland does have a higher healthcare cost compared to a lot of other countries, but the big advantage is that they're able to provide universal coverage, so basically everyone has access to the healthcare. The government still helps out by giving subsidies, especially for people with lower incomes, so they can afford their insurance. And something important to note is that Switzerland is constantly making changes and reforms to keep healthcare more affordable, since balancing high costs with universal coverage is an ongoing challenge. Okay, healthcare financing in Switzerland. Now I'll go a little more in depth on how the system is actually funded and structured. So the main source of funding comes from those mandatory insurance premiums that everyone has to pay. On top of that, people also pay out of pocket costs like deductibles and copays, and then the government contributes through tax funding, as I mentioned before. Over 60% of healthcare costs are paid directly by households, which shows that individuals take on a big part of the cost in this system. Looking at the insurance system itself, it is required for everyone, but it's run by private nonprofit insurance companies. These plans cover essential services, but one key thing is that premiums aren't based on income, which can make it harder for some people to afford the healthcare. There's also cost sharing built in. For example, people have to pay a yearly deductible that ranges from about 300 to 2,500 Swiss francs, plus about 10% coinsurance and even a small daily hospital fee. This is meant to encourage people to not overuse healthcare services. The government's role includes funding hospitals and infrastructure, and also providing financial help to lower income individuals through subsidies. Overall, Switzerland's system is known for having very high healthcare costs, but it still manages to provide coverage for everyone. Because of those high costs, they're continuing to work on new reforms to improve affordability, including some recent efforts in 2024. Avery will now discuss access to care and health outcomes in our presentation. Thank you.
Hello, my name is Avery. I'm going to be presenting the access to care and health outcomes portion in today's presentation. First, I would like to start with access to care. Overall, access is strong with high availability of services and relatively short wait times. Many of these services also offer telehealth and mobile health options. This helps make care more convenient and easier to reach. In addition to that, patients often have access to complementary and alternative care services. This might be like your chiropractors, your acupuncturists, things that might be a little more specialty and you might not need on the daily, but are nice to have them when you need them. Having these services helps broaden your treatment options. However, there are still some barriers. For example, if you live in Switzerland, it is mandatory to have insurance. It's a non-negotiable, you gotta have it. Plus, it might also come with some high premiums and high deductibles. And you might also have to pay out of pocket for those complementary and alternative care services. That being said, access is genuinely supported by factors like having transportation, short distances to your providers, and flexible providers, also having accommodations for language and disabilities. Switzerland takes seeking out care and getting access to care very seriously, so they take things into consideration like your cultural beliefs, your social factors, making sure you feel comfortable with your provider, things like that. Overall, despite some financial barriers, the system is considered efficient and provides relatively strong access to services. Now, I'm going to do the health outcomes. Switzerland has one of the best health outcomes compared to any other high-income country. People tend to live longer, which shows the overall quality of care that you're going to receive. Also, people have reported to feel very impacted and satisfied with having those complementary and alternative care services. Also, Switzerland takes preventative care very, very seriously. They stress a lot on getting those regular screenings, vaccinations, and making sure that you're overall having that healthy lifestyle. That could be eating right, exercising, and getting the sleep that you need. Also, Switzerland cares a lot about how you're doing mentally. Yes, it's going to be stressful living in such a high income country, and life is just hard in general. So they want to make sure that you're covered mentally. Your insurance will help cover any mental health service that you might need. This helps improve your overall well-being, just having those services. Overall, strong preventative care, good access to services, and high quality treatment all contribute to better health outcomes. So now Marcel is going to be presenting these strengths and challenges. Thanks.
Hello, I'm Marcel Pearson, and I will be covering the strengths and weaknesses This is also known as challenges, the quality of care for Switzerland, and the references for our group presentation. The strengths of Switzerland's healthcare system include their quality healthcare and their good access to care, which kind of work hand in hand and will be mentioned further next slide. And another strength is how the citizens are involved in their healthcare system. They're allowed to make changes and put their input in. They can request changes to the board of the different boards of the healthcare system, and they are even able to campaign to be somewhat involved in the healthcare system boards. They are also able to have multiple ways to affordably pay for their healthcare, which means that there's allows for a competitive market to be formed, which makes it so the healthcare system was more healthy financially for the citizens. Weaknesses towards the Switzerland healthcare system include the rising costs, which means that healthcare procedures are more expensive, the increase in non-communicable diseases, which means that there has to be a wider range of healthcare, and that healthcare will be a longer and more financially difficult process for citizens. There's also an anticipated shortage in healthcare professionals because there is looking like there's going to be a decrease. So healthcare professionals won't be able to manage every single citizen that needs the care that's needed. And then the last big weakness of the Switzerland's healthcare system is the distribution of information across the healthcare system. The availability of healthcare makes it so Switzerland citizens can go to basically any clinic and be treated, but this means that their information has a higher chance of being lost or there being discrepancies within the information because it has to transfer between so many different places. These graphs show a little bit more detail about more expanding strengths and weaknesses from the healthcare system. Next is the quality of care in Switzerland. Um, Switzerland performs better than 95% of the OECD in most categories. The OECD is the Organization for Economic Cooperation and Development, which is an otherwise a union of European countries that compare their systems. In some of the ways that Switzerland performs higher ranked in is their life expectancy. They have a life expectancy of 93.9 years, which is 3.6 years above the OECD average. They have a higher increase of risk factors, which is one of the unfortunate things that they beat other countries in. They have more smoking and more excessive eating of greasy foods, which means that there is a higher chance of disease down the line. And so it is unfortunate that that fact is above most other countries. But on the bright side, they also have a higher availability of care. So citizens are able to treat any illnesses or diseases that they may have easier and faster. The health expenditure in Switzerland is about $8,000 per person. So Switzerland very much cares about providing the money so that their citizens can have the financial stability to receive healthcare. And in combination with all these qualities, it allows for Switzerland to be elite in many different stations. They are number two in healthcare technology. They are number two in choice, which means that the competitive market works so that the citizens can choose which people they want to go through to provide their healthcare and what they want to pay for their healthcare with, which means that healthcare overall is a healthier circumstance, both financially and socially. Switzerland has the number two healthcare system out of the OECD, which means that just in general, their quality is very good. They're number one in advances, so they're always advancing and making their healthcare quality better, and they're number six in prevention. So despite the fact that the risk factors are better than many of the OECD countries, they're also working and doing a good job at preventing care in working around the risk factors. If you look into these charts, you can see how Switzerland is able to prioritize patients so they don't have as much as a wait as other countries do. And then if you look at the services, you can also see how well they're able to achieve those because of the quality and the accessibility of the Switzerland healthcare system. These next two slides cover the references we used throughout the presentation, and they should be linked on some of the slides on which information is correlated to which slide. Thank you for your time. We have been at group number 9 on the HCA 1115 Global Health Systems class covering Switzerland. Thank you for your time.